Hello, Bell's Palsy here and happy Friday. I hope you had a great week and that you are still making progress in treating your Bell's palsy and facial paralysis. So today I would like, in continuation to my previous post this week, go over a little bit more into detail over the flaccid stage of Bell's palsy. And that is in regards to, you have to know what kind of stage you're in and what your face is able to do in order to treat it correctly during that specific stage. So during the acute stage of flaccid paralysis, when you have very little to no movement on the involved side, I'm going to refer to my right side as the involved side since that's the side that was paralyzed when I had Bell's palsy, and then my non-involved side or stronger side at that moment would be my left side. So what you need to know is when you have the acute paralysis, the nerve is injured and cannot function. It cannot deliver the electrical message from the brain to the muscles of the face. So if you will, it's just like if you were trying to use an electronic equipment or watching TV and trying to make it work without plugging it into the wall, or if it was plugged into the wall, if there was a power outage. Basically, that kind of sums it up there. You cannot force a muscle to move if there is no conduction from the muscle. So during that stage, what you need to concentrate on is not trying to move your face, such as with all the facial exercise you've been seeing on YouTube and other maybe social media, or when you've been Googling treatments for Bell's palsy. All those generic facial movements are generally very poorly done by most patients, even when they would be a little bit more appropriate down the road, which would be during the paralysis stage. But most of what you found online is not really teaching you the right way. It only leads to more exaggeration of movement, which you should never do. So trying to move a muscle that has no nerve conduction and trying to make it move is just a waste of time. So don't do this during the acute stage of your Bell's palsy. Instead, your goal during that stage is to prevent complication that could happen if you do those exercises, actually, because they're only going to lead to the wrong movement pattern, because you have that side that's not working, and all you're going to do is to re-emphasize the strong side, only make the strong side stronger and tighter. So during that stage, once again, what you want to do is prevent the complication by keeping your face on both sides, involved and non-involved side. You want to make sure that you keep moving them by massaging them and by stretching. I'm not going to go into right now into details as to with each muscle how to do this. You can find that in my tutorial that is available online. I will go into more detail in future posts on specific muscle as well. But for the sake of this post, what you need to know is mostly spend time massaging your face at least once a day. I think it's okay to do it twice. Spend a few minutes on each spot. So for example, on your forehead, I would massage up and down and in all directions. So this is one example, and I would do it on both sides. The other thing that you need to do is also stretching. And stretching particularly your strong side initially, because your strong side is overworking all the time with everything you're doing during the day, eating, drinking, all the facial movement. This side is overtaking the weak side and is gonna become tight very quickly. Where that tightness become problematic is further down the road once you regain movement with on the involved side. If the pull is too strong on your strong side, these muscles at first especially are going to be too weak to even match that force. So it's like a tug of war, if you will, where you're going to have the strong side pulling everything this way and this not being strong enough to kind of bring back everything into symmetry toward the midline. And symmetry is really the goal there in this stage, is to keep your face as symmetrical as possible at rest, and even with movement when you're going to be moving your face with just your day-to-day things. But that is the key to remember during the flaccid stage of Bell's palsy, is you don't really want to practice movement. You just want to take it easy, massage your face. That will bring some blood flow. That will also retrain your brain to remember what movement is on your inverse side. Because if you have a pretty severe case of Bell's palsy, it might be months before you can get some or other type of facial paralysis. It might be months before you regain some movement. And if nothing has moved on that side, it's going to be hard for your brain to relearn how to move and to reconnect with that area. So that's the benefits of massage and of stretching. And we will go in more details in future posts. It's also, again, available on my tutorial. But I just wanted you to know this. So if you are in the acute stage currently, hopefully you're going to be working on the right thing and not waste your time in making exaggerated faces, which could lead to complication. So that was my announcement for today, and I hope you have a great weekend, and I'll catch with you later. Bye-bye.